not in the mood today. All right, everybody pick your teams. You know your lab groups. 1, 2, 3, 4, 5, 6, or 7. Yep, just hit whatever number you are. Because your lab group 2, you hit 2. That's 27 people because Ryan is not here. All right, group number 1. Pick a category and a number. These are going to be over your National Registry drugs. Let me make sure I started the recording. I did start it? Okay, perfect. These are National Registry drugs. Do you remember that list I gave you at the beginning of the semester for pharmacology? It had that you did your drug cards on? All 36 drugs, I think. 36, 39, something like that. That's what your next exam is on. And so I pulled a lot of those drugs out and made you a Jeopardy game to kind of go through some of the highlights of those medicines. You need to know what they are, both names, the generic name and the trade name. You need to know the dosages, adult and pediatric, and you need to know what they are used for, what medications they're used for, what they use to treat, all their indications. So you need to know the name, classification, dosage, adult and peds, and indication. There are 4 things you need to know about all of those drugs, so use your drug cards. That will be test 4, which will be next Tuesday.
Is it just on that?
Just on those drugs.
So 36, no, 36.
36, 39, something like that. I can't remember. And then you have a math quiz too. All right, team 1. 1 for 1,000. All right, EMS responds to a patient who's complaining of not feeling well. Upon assessment, you see that the patient has nausea and vomiting and diarrhea and is diaphoretic. He states that he was spraying pesticides and started to feel ill. What medication can you give that would help with this patient? So he's been spraying pesticides, and all of a sudden he starts having some nausea, vomiting, diarrhea. He's diaphoretic, not feeling well. Everybody good with that? So what medication are you going to give him? Needs to be the correct medication and the correct dosage. Nausea, vomiting, diarrhea, diaphoresis. Overall, general feeling of not feeling well. He was spraying pesticides. Started to not feel well. What medication are you going to get to help with all of his symptoms? Everybody answer. Oh yeah, you weren't here the other day. I'm sorry. Everybody answers. Who won last week? Team 5? Group 5, yeah. Group 5 won last week. All right. You got 5, 4, 3, 2, 1. The correct answer is atropine. What's wrong with that patient? Sludge from organophosphate poisoning, right? Organophosphates are found in pesticides. Highly dangerous chemical. That's why you need to gown up, glove up, everything. These patients are also going to have to be decontaminated, so you're going to have to gown and glove up yourself. I've only had one patient like that in the 9 years I've been a nurse in the ER, and we had to decontaminate him outside and bring him in. It's just a big old mess. Atropine, and it's a very high dose of atropine. What do you normally give atropine for? Sinus bradycardia. How much do you give? 0.5 to 1, right? 0.5 being the first dose. They would get a very high dose of atropine to help with organophosphate poisoning because they are having sludge. Everyone remember what sludge is? Salivation, lacrimation, urination, defecation, gastroparesis, which is just vomiting, diarrhea altogether, and emesis. All right, number 2. Emesis is puking. That is correct. Number 2? What do y'all want? Pick one, Kimberly.
Category 2, 600.
Oh, it's time for a daily double already? All right, every group has to wager a certain percentage. 0, 25, 50, 75, or 100. They got 10 seconds to wager. 9, 8, 7, 6, 5, 4, 3, EMS is called in the home of a 28-year-old male patient who has overdosed on his father's verapamil. What medication and dosage can help reverse the effects of this medication? So, an adult patient who's overdosed on his father's verapamil. All right, what you gonna give him? The correct medication and the correct dosage. Correct answer is calcium chloride. Can you give calcium gluconate too? Yes, they're pretty much almost the same thing. It is 500 to 1,000 of calcium gluconate. Exact same dosage. Why they're not just called the same doggone thing, I don't really know. What is verapamil? It is a calcium channel blocker. And so what is this going to do? It's going to block the other receptor site so that it will help to reverse the effects of the verapamil overdose. Now, if verapamil is a calcium channel blocker, what's it used for? Oh, so their heart rate. So if they overdose on it, what's going to happen to their heart rate? It's going to slow down. They're going to have bradycardic. You think atropine is going to help with that? No. Why? Because it's still blocked. The calcium is very, 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 very overly saturated. So the calcium chloride, 500 to 1,000 is the correct dosage. Calcium gluconate would have worked too, except that's not the correct dosage. You wouldn't give dextrose for this. And sodium bicarb helps with another reversal, which we'll talk about later. Group number 3. What do y'all want? 3 for 1,000? Okay. A 7-year-old patient takes 15 aspirin tablets. What medication, along with the correct dosage, can help reverse the effects of aspirin? When you have an aspirin overdose, what do the patients normally complain of? Do you know? With aspirin? What is aspirin? It's an antiplatelet. They complain of ringing in the ears, also known as tinnitus. And patients who have had overdoses of aspirin in the past will have a lifetime of tinnitus. It's just a little tidbit for you. All right, what medication are you going to help give them? Correct medication and the correct dosage. You got to think, this is a pediatric patient too. He was 7. Do you need the stickers? Apparently that's what I need.
Why is it worse to overdose?
I didn't even bring any candy with me today. I'm sorry. Yes, ma'am?
Why is it worse to overdose on aspirin than it is like cocaine and all the other drugs?
Is it worse to overdose on that?
That's what the doctor said.
Really? I didn't know that. Yeah, that's true. You're going to suffer a lot longer. Cocaine's going to explode your heart very quickly. You're not going to have time to play. Same thing with Tylenol. Like Tylenol overdoses, those have a slow, painful death because once those Tylenol levels reach a certain amount in the bloodstream, there's nothing you can do to reverse it. No amount of mucomist is going to help. And they're going to die of liver failure. Very slow, painful death. All right, one more person. There we go. Y'all are so smart. Sodium bicarb. And this is a 7-year-old patient. If you notice, sodium bicarb has the exact same dosage for adult as it does for peds. There are several of your medications on that sheet that have the same dosage for adult and peds, so I would know those. Make sure that you help. Make you a chart. That's the easiest way to do it. All right, group number 4.
2,000.
Everybody else was picking their own category number. Nothing. Category 2 for 1,000 points. According to the lidocaine clock, you need to give a patient 2 milligrams of lidocaine for a maintenance dosage. How many drops per minute would that be? You have 15 seconds to answer. According to the lidocaine clock, you were taught, you need to give 2 milligrams of medication for a maintenance infusion. Lab. You got 15 seconds. Go. You got to give 2 milligrams of lidocaine. 5 seconds. If you don't know it, you better just answer. Woo.
I know it's the dopamine and lidocaine part. I remember going over that.
What do you think is the right answer?
2.
No. It is 30.
That was just us, wasn't it?
I remember Tyler did that. Probably never mind. That is the dopamine and lidocaine.
Easy. You got that? That's why you got it. That's why you got it right. It's not hard. I didn't put a dopamine clock on here so y'all don't start freaking out trying to remember what dopamine and lidocaine clocks are. Dopamine actually works better to me if you use the...
It goes 15, 30, 40, and 60.
15... 45, sorry, thank you. It's 2 milligrams.
30 means 2. On that clock.
2 milligrams, you give it 30 drops an hour. 30 drops a minute, excuse me. All right, group number 5.
5 for 8.
We're getting rid of these daily doubles quick. All right, pick your poison. One more. All right, here we go. This is a calcium channel blocker that is used in the treatment of atrial fibrillation. What is the correct medication and correct adult dosage? So you're looking for a calcium channel blocker that's used in atrial fibrillation, and you need to know the correct dosage. Which one is it? Calcium channel blocker used in atrial fibrillation. What's the correct name and the correct dosage? There's 2 possibilities, but only one is a calcium channel blocker. Five, 4, 3, 2. Correct answer is diltiazem, also known as cardizem. What else can you give cardizem for? Well, yeah, you can break it. What else? Atrial fibrillation, atrial flutter. Also can be given during SVT when what doesn't work? Adenosine doesn't work. The correct dosage for cardizem is 0.5 milligrams per kilogram.
That's not what's up there.
0.25 milligrams per kilogram.
Oh, all I heard was 0.5.
Oh, sorry. Probably said 0.5. Meant 0.25. All right, number 6. Y'all high rolling today. All right, EMS is at the home of a 28-year-old female who just gave birth to a healthy baby boy with an APGAR of 8 at 1 minute and 10 at 5. You notice that the patient has a sudden rush of bleeding from the vaginal area of approximately 750 milliliters. What medication and dosage can you give that would be most helpful? All right, pregnant female, healthy baby, healthy delivery, 750 milliliter blood loss. What you gonna give her? 3 more people. 5, 4, 3, 2. Correct answer is oxytocin. Oxytocin at 20 to 40 milliunits per minute is going to help with postpartum hemorrhage. Postpartum hemorrhage is anything over how much blood loss? 500 milliliters.
What's it also known as?
Pitocin, also known as Pitocin. How else can you help with postpartum hemorrhage if you do not have oxytocin trucks? Bundle massage. What else? Giving the baby to the mom to what? To nurse, to breastfeed. All right, why wouldn't you give LR at 10 mLs per kilogram? Huh? Why wouldn't you? What's the normal dose for a bolus for an adult? 20 mLs per kilogram. When do you give 10? Infant. Infant. Everybody over the age of 1 is 20 mLs per kilogram. Infants, anybody under the age of 1 is 10. All right. Who's next? Group 7?
Category 3 for 800.
What is the treatment for this for a patient who has a pulse? They have a pulse.
Drive fast.
What are we going to give them? Drive fast. That's right. High flow diesel is what Hayden's going to give them. I must put that as an answer too. Because somebody would pick it. True. He's not here. He has strep throat. He came in and took his test while in another room while y'all were taking yours. I didn't figure y'all want strep throat. Figured y'all would appreciate that. Huh? Ron. Yeah. Yeah, he woke up with white patches on his tonsils this morning. You didn't kiss him, did you? All right, everybody got that one right?
Can you get strep throat without me?
You can, yeah.
You're just
That helps to reduce your chances. All right, good job, everybody. Magnesium 1 to 2 grams in the 50 to 100 milliliter D5W over 55 to 60 minutes. Can't talk today. Group number 1, what you want? What is the pediatric dosage for dopamine? Pediatric dosage for dopamine. I had to make the 1,000-point ones hard. Harder. My dyslexia kicks in when it's stuff like that. I always see stuff that's not there. Pediatric dosage of dopamine. Pediatric dosage of dopamine. You want to be sure of that before you start kicking. Yelling it out in the class. You want to make sure you're right. All right, 5, 4, 3, 2, 1. Correct answer is 2 to 20. It's the exact same dose for peds as it is for adults. Obviously, 26% of the class didn't listen to you. I don't know that they would, though. Do you think they would? No.
Randy, I thought the adult dose was 2 to 10.
No, it's 2 to 20.
She said that over and over and over.
Yeah.
Oh, that stinks.
On that drug test, we took
It's a max dose of 20, so it's 2 to 20. You start it between 2 and 10, and nobody else starts with 2. Everybody else starts at 5.
we have a lot of problems with these.
Yeah, that's what happens when
And also
you look at your protocols.
We had 0.42. when y'all been screaming 0.4 to 2 for Narcan. Y'all been screaming 0.4 to typhoid.
No, we've been screaming 0.4 to 2.
I'm not screaming.
It's paramedic school.
It's paramedic school, that's right.
Before that it was.
For that, it was like, what, 1 to 2, I
I
think?
just looked at 0.4.
If you get somebody 2 milligrams of Narcan, somebody's going to kill you. Either the medic you're riding with or the nurse you're going to take them to. One of them's going to kill you. All right, number 2. What you want?
4 or 800.
All right, this patient is alert and oriented, complains of an uneasy feeling in his chest. He's 49 years old with no medical history. Vital signs, pulse of 192. It does, doesn't it? I'm sorry. I won't spray it anymore.
That's rough.
Sorry. To me, it smells like dirty socks. Come out here, y'all. Come smell the board.
How's it getting worse?
It's gross. Gross.
Like somebody shit in the sock.
It doesn't smell like poop. It smells like dirty socks.
It's gonna be
Huh?
wonderful.
All right, what you gonna give him?
Boo boo, is that
That's better than saying the word Kane wanted to, isn't it? You're not standing up here next to it.
You ought to spray that on the disaster drill dummies.
We're not using dummies. It's just spreading.
You don't think we're just making stuff up over here, aren't we?
All right, the correct answer is amiodarone first of 150 every 10 minutes, repeated as needed if VTAC reoccurs to a max of 2.2 grams in 24 hours. When do you give amiodarone 300 milligrams? Unstable. Oh, you're so smart. Number 3. Primary treatment. This patient has a pulse and is complaining of an uneasy feeling in his chest. Primary treatment. Go.
Look at that infusion.
Have you not paid any attention to some of the other answers? They're not right.
I know, but still. I don't know what's going on with drug cards.
Look in your book. That's where it came from.
I brought my own.
Correct answer is the Denison 6 milligrams first, followed by a second dose of 12 milligrams. Don't give a third dose anymore. Back. There we go. All right, group number 4.
Yeah, 1-800.
What's the primary treatment for this? Y'all should all know this. That shouldn't be a problem. That's correct. Atropine 0.5 milligrams IV for the first dosage and repeat every 3 to 5 minutes for a max dose of 3. All right, group number 5. What you want? This medication is used in the treatment of bronchospasm in patients with reactive airway disease and COPD. Its normal adult dosage is 2.5 milligrams. What medication can block the pulmonary effects of that airway medication that is described? So you need to know what that medication is, know it in your head, think about it, and tell me, when I pull this list of drugs up, what medication is going to block the effects that this medicine is supposed to do. That make sense? You're good? You know what medication it is? All right, which one of these home medications is going to block it?
Home medication?
Home medications.
Maybe at home.
You take them at home.
Oh,
So you have a patient with COPD who's having bronchospasm, and you go to give them that medication. If they're on one of these home medicines, it's not going to work as effectively. Which one is it?
Why do they have a pharmacy in the home?
Because you can't just go to the store and buy fresh food.
No, you have to make it. Gosh, Hayden, are you living under a rock?
Yeah, he is.
I really want to go crawl up under a rock.
Sorry. Y'all are so smart.
Yes, y'all
Look at y'all. What is metoprolol?
are.
Beta blocker. What medicine were we describing? Albuterol. All right, who's next? Group number 6.
Let's go 1 for 600.
Let's go what?
1 for 6.
All right. EMS is called the home of a 70-year-old male patient who's having chest pain. He states that he has taken his home medications, which consist of 81 milligrams of aspirin and 25 milligrams of metoprolol and a 10 milligram Zyrtec. EKG shows ST elevation. The patient complains of dizziness, shortness of breath, and chest pain. Vital signs are listed as heart rate of 60, blood pressure of 110/70, respiratory rate of 20, and an O2 sat of 98% on 2 liters nasal cannula. En route to the hospital, what medication, along with the correct dosage, would you administer? This patient has no known drug allergies. You ready? You don't have to take pictures. I'll make sure that we post it on the thing for you. Easier to see that way. What is the correct medication to give? All right, 5, 4, 3, 2, 1. Man. Why would you only give 243 milligrams? I didn't think I was going to get you. Because he already took an 81 milligram aspirin, right? But I thought this was right. Is that not right? You don't give it PO because it don't work. What about morphine? You're going to confuse somebody. Quit it.
What happens when Granny swallows that?
Nothing. My pills don't work. That's what you're gonna get. All right, who's next? Number 7. Who's number 7? Y'all are number 7.
Category 4, 4, 2, 6.
Which one? EMS is called the home of a 19-year-old female who's overdosed on heroin. All right, she had way too much party time last night. What medication can you give that will help reverse the effects of heroin?
Anti-heroin.
Exactly. Which one of that is that? Really, you don't? Five. Thank you.
Cover them with fentanyl.
You are so smart. You cover them with a fentanyl patch. That's exactly right. The correct answer is naloxone, also known as Narcan, which is a dose of 0.4 to 2 milligrams IV. Tell me about it. Y'all are phenomenal.
We just submit this PowerPoint. Is this what they have? Are these something like questions that we're going to have?
Some kind of similar, yeah.
So all of our stuff's gonna be scenario.
It's going to be, most of it's going to be scenario based. So you'll have to figure out what's going on and what you're going to give them.
So that's how we like, this is
You might have a couple of those knowledge-based questions, but most of it's going to be
Pretty
application-based.
much kind of just like the rest of our registries.
All right, next, number 7. Y'all just went, so number 1. All right, which seizure medication can be given rectally? Which seizure medication can be given rectally?
first hit.
Why didn't none of them go in?
Everybody got it wrong.
Well, there's no more daily doubles, so
Look at that.
it's not gonna work.
Go back.
Yeah, you can just go back and redo it.
You go back and see if it'll open it back up.
We could.
It's not gonna work anyway.
That's what I figured.
We know that.
It's not working.
Well,
There it goes. It calculated it correctly. It just didn't have the little chart up there. Correct answer is diazepam, also known as Valium.
I saw that.
Seen it again rectally?
Yeah.
Oh. All right, group number 2. What you want?
What's in his roommate?
5 for what? What's the primary treatment for this? I'll leave you to answer that.
See,
We had this question last week, so y'all should get it all right.
and we disagreed with it last week also.
Right, and we talked about it, remember?
As to disagreed.
If you're in the back of Walmart, you gotta get the patient loaded up because it's right. Or you can travel out back.
Let's see just how many of y'all remember this question from last week in our discussion about it. Why did it not work? What are y'all's answers? They already picked 2? It didn't work.
Go back and see if they do it like you did earlier.
Start over.
Stupid little game. Here it goes. Everybody got it right. It's 100%. It's supposed to be on the 2. Everybody got it right.
Don't you end the show? Don't you do this stuff? I'm not done.
For the love of the manufacturers.
Oh, Jesus.
My Jeopardy game score does not reflect my
We already did that. Let's go back. There we go. All right, number 3.
3 for 4.
EMS called the home of a 5-year-old male patient who has nausea, vomiting, and diarrhea for 3 days. Patient's mucous membranes are dry and he is lethargic. Medical direction orders a fluid bolus. The patient weighs 34 kilograms. How much is he going to get? He's 34 kilograms. Put your phone down.
We can't do that kind of math in our head.
Yeah, you can. Made it easy for you.
No, easy is 2 plus 2.
Unless you're 5 years old. Me and Logan are working on math right now because they're starting to do addition and subtraction.
Ooh, that was the hardest time in my life.
My gosh.
They're teaching it in such a stupid way now.
Wait till more.
What's it called?
With the counting, we have to count. Like make little things to count. Yeah, I taught him how to use his fingers last night instead of using objects. It's easier.
I still use my fingers. Are you still gonna?
I do too.
Especially if I'm counting. I still do too.
All right, the correct answer is 680. Why? What is the fluid bolus for a 5-year-old? 20 per kilo. 34 times 2 and add a 0. All right, why would it not be 34, or excuse me, 300? That's 10, right? That's 10 kilo, 10 mLs per kilo, which is for patients under the age of 1. 34 times 2 and add a 0. That's 20 mLs per kilo, so 34 kilos times 2, and then you add a 0 at the end. All right, number 4. Huh? This medication is an anticholinergic and a bronchodilator. It's given as an adult dosage of 250 to 500 micrograms via nebulizer every 20 minutes for 3 doses. Pediatric dosage is the same. There's another one. That's 3 so far that has the same dosage, right? What drug is this? 5, 4, 3. Y'all get that much albuterol, that's just gonna be a disaster. What's the albuterol dosage? We just talked about that a few slides ago. 2.5. I can't ever say that word. Atrovent is the other name. Ipratropium. Thank you. All right, next. 4. What is the correct dosage for that? I can't say that word either. Midazolam. Midazolam, thank you. There you go, that sounds good. What is the correct dosage?
I did. Did you take one? Five.
All right, 5, 4, 3. Thank you. All right, what is that medication? Versed. What is Versed used for? Sedation. Correct answer is 2 to 2.5. 2 to 2.5. All right, number 5. What you want? Oh, he says 2. EMS is called the home of a 1-month-old infant. This patient is unresponsive and has an AccuCheck that reveals a blood sugar of 29. After consulting with medical direction, you are ordered to give a medication. So which dosage and medication are you going to administer? Which one do you think medical direction is going to tell you to give? 1-month-old, blood sugar 29.
Why didn't you say them? Because I wasn't sure enough for you to look.
Because she's not used to you being wrong. You let her down. She's very disappointed.
All
Alright, 5, 4, 3, 2, 1. Blast off. Wowzers. Okay, 48% of y'all, I'm going to smack. You give a 1-month-old 50% dextrose? Are you kidding me? Seriously? No. What percentage do you give? 10. For the love of banana crackers. Don't y'all remember us talking about this? Adults get 50%, which is the whole regular thing, right? Then pediatric patients, 1 year and older, get what percentage? 25. So you spill half of it out, pull up the rest of it with saline. Sam did it wrong too?
Guess what? This girl's not playing anymore. They're on their own. I will push my button, but they're
Then infants under the age, or pediatric patients under the age of 1 are considered infants. They get 10%. That patient would get 200 milligrams of a 10% solution.
Where did 200 milligrams come from?
That's the dosage in your book. 10% solution should have gave it away for you. Infants get 10% solution. 78 of y'all, percent of y'all are gonna kill them. That's bad. That's bad.
So much easier.
Bad. All right, who's next? 6.
We'll take them 1 for 4.
This drug is a benzodiazepine and is used for seizure control. It can be given IM, IV, or IO. It must be diluted with equal volume sterile water or saline. Let's talk about sterile water for just a second. Who do you give sterile water to? Okay, infants are the only ones that will get sterile, something mixed with sterile water. You look at sterile water vials, they have a pink top on them to help you remember peds, and those go for infants.
I've never seen sterile water about.
A lot of places don't have them.
Sterile water juice. Yeah.
They're little bitty bottles that have a pink top. The ERDS Alabama has them, I know that much. So I'm pretty sure ETS should have some. They don't have any?
Okay. Sterile water.
Anyways, sterile water or saline can be given if it's given IV or IO. You mix equal parts. What is the medication and correct dosage? So it's a benzodiazepine used for seizure control. What is it? I'm sorry. These are all, if you've noticed, all of these words, all of these names are generic names. Because you should know the trade names. Those are pretty easy to remember. The generic ones are pretty hard. Benzodiazepine can be given IM, IV, or IO. If it's given IO or IV, it has to be mixed with equal parts sterile water or saline. It is given for seizure control. But its only routes are IM, IV, or IO. You sure?
I had nothing to do with it. I participated and pushed my buttons.
All right, 5, 4, 3, 2, 1. Lorazepam. We already talked about diltiazem. You remember that? Cardizem. It's not used for seizure control. What's it used for? Cardiac dysrhythmias of the atria, so atrial fibrillation or flutter. All right, diazepam is known as Valium. Diazepam is Valium. You can give it rectally. That's how it comes through that off for you. But also, what's the dosage for diazepam? 5 to 10. That is correct. Y'all are so smart. Y'all are going to blow this test out of the water. All right, let's just start clicking. Well, 78% of y'all are not. Given dextrose 25%. My heavens to mercy. EMS is called the home of a 26-year-old female who has 34 weeks gestation, complains of nausea and vomiting for 3 days. Her heart rate is 125, her BP is 110/70, and her respiratory rate is 20. She's 99% on room air. What medication, along with the correct dosage, can be given to her for her nausea and vomiting?
I'm sorry, man.
At 34 weeks pregnant, you want some Propofol. I am too. I'm starving. Y'all are so smart. Why wouldn't you get Phenergan?
That's another reason we don't listen to you.
Huh? What is Phenergan? Is it category C or D? I'm not 100% sure. I want to say it's D. Look it up, Christina. I think it's D. It's C or D. It's one of those. It's not given to pregnant women at all. It does. Look at you, Missy.
Well, that's what they put.
Thank you for coming to class today.
That's what they put.
You don't give it IM or IV to pediatric patients. They can take suppositories or PO tablets, but you can't give it IM or IV anymore. It's a category C? All right, Phenergan's category C. How long has it not been given to... Do you take it? Your baby's turning out okay? I took Zofran like crazy with both of mine. What is the correct dosage for Phenergan? 12.5 to 25. No, people get 50. Phenergan is also can be used during an anaphylactic reaction. Works as a histamine blocker. All right, category 1 for 200 points. This medication is a category B. It is given for allergic reactions. Also helps with seasonal allergies. The adult dose range is 25 to 50 milligrams. What is the correct medication? Category B, given during allergic reactions, also can be given for seasonal allergies. Y'all are so smart. So smart. This medication is no longer used on most EMS services. It was used for medication overdoses that were within an hour time frame. What drug is this? No longer used anymore in the pre-hospital setting.
I told you it was very
Five. Activated charcoal. Good job. Maybe the other 75% of y'all are smart. Smarter. All right, last one. Here we go. EMS is called the home of a 48-year-old male who is a known alcoholic. The patient is unresponsive and has a glucose reading of 29. What you gonna give him first?
All right.
First.
All right, when you pull up.
First. Yes. Unresponsive, known alcoholic with a blood sugar of 29. What you gonna give him first? Five. Thank you. Y'all are so smart. You're gonna give him thiamine. Why? What does it do? It tells the cells, hey, open it up and give me some glucose. Tells the cells to be able to get that glucose. What are y'all doing?
I ain't done yet. I ain't done yet.
That's rude. 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 Team number 6.
Why are we not over there?
Because it only goes top 5.
Because Sam was wrong a lot.
Good work, boys.
All right, top 5 teams are team 6, 1, 3, 4, and 7.
Take these up too.
Please.
Are you blaming this on me?
Hey, listen up for just 1 second. Thursday. What time you gonna be here if you're not cooking hamburgers? 8:30. Where you gonna be at? In here? And what you gonna wear? Field uniform. Somebody's gonna come in scrubs, y'all. I'm telling you. Somebody's gonna come in scrubs. You're gonna be in trouble. Where's this go? Cousin's got it. Because you don't work in scrubs as a medic.